Iridology, the scientific analysis of patterns and structures in the iris of the eye. By studying the intricate patterns of the iris, you can enhance self-awareness, improve the quality of well-being in yourself, and identify areas of inherent weakness. Follow along as we begin our journey into the iris and the potential health benefits this profound study could have on the way we seek medical advice in the future.
Hi, I'm Ron Logan. I'm going to introduce to you the field of electromedicine, a field that's going to be a part of the paradigm shift. I want to introduce to you a machine that's been created that may help in this field and give you some background to that. In fact, this research report on radio frequency technologies has a lot of good information about this interesting field. Extremely low, safe amounts of electricity, a few thousandths of an ampere, have been found to be beyond the tolerance level of pathogenic life forms. And they have been proven to kill or devitalize even HIV, herpes, tuberculosis, hepatitis, colds, flu, other viruses, fungi, parasites, and bacteria in blood and body fluids, rendering them ineffective to infect or to affect normal, healthy cells, while maintaining the biological usefulness of the blood and other body fluids. Doctors at Albert Einstein University or College of Medicine in New York City have proven that minute electrical currents render ineffective any bacterium, virus, fungus, or parasite without harm to the blood or body fluid. The doctors report here that the amount of electricity used is no more than 2/1000ths of an ampere. Independent scientists and researchers have proven, however, that in vivo in the body, electromedical techniques are not only safe for humans, but perform quite thoroughly, and systemic infections are wiped out without invasive surgical implants or extensive hospital care. Now, recent U.S. and international patents report that extremely small amounts of electricity are beyond the tolerance level of microbial life. These electrical forces have been proven to kill and devitalize bacteria, viruses, fungi, parasites in the blood and body fluids without any adverse effects. There are the U.S. patent number 051888738, granted in 1993 and held by the Albert Einstein Medical Center, and those doctors mentioned just previously described in an in vitro or outside the body apparatus for removing the blood from one arm, electrifying it, returning it pathogen-free to the other arm in a process similar to dialysis. This patent describes a proposed in vivo or in-the-body technology as a surgically implanted battery-operated device similar to a heart pacemaker. Dr. Stephen Kaele, one of the patent holders, claims that in vivo devices will take years of testing before it is ready, even though no harmful effects or side effects or pathogenic mutations over the past have been indicated. But critically ill persons who have exhausted pharmaceutical therapies, meanwhile, fight for their lives, and without the knowledge that these electromagnetic therapies are available and may well help them. Scientists, MDs, and individual researchers working independently report that in their in vivo techniques, they have been all completely safe and highly effective. However, the United States Food and Drug Administration has issued warnings that they would be prosecuted for making any beneficial claims about this technology. So the FDA, the American Medical Association, have put a stranglehold on the efficacy and the safety information gathered over recent years by numerous scientists, researchers, normal practitioners, even though reportedly amazing results have been achieved on humans with their in vivo techniques. The threat of jail and license suspensions looms constantly over them, as in vivo human testing has never been approved and probably never will be. But according to scientist Bob Beck, Doctor of Science, who has his doctorate in science and who is responsible for designing two simple in vivo blood electrification techniques, many of the HIV/AIDS patients using his modalities have reached undetectable viral counts as proven by polymerase chain reaction or PCR testing at between 4 to 8 weeks of 2-hour-a-day therapies. And still, he says, he is constantly threatened by U.S. medical authorities. He is perhaps the most vocal critic of an alleged pharmaceutically based conspiracy to cover up and discredit electromedical movements. Records indicate that in the 1930s, the Flexner Report declared the use of electricity as medicine quackery, conveniently ushering in the new antibiotic wonder drug age, which we are all now quite sick of. But at the time, 10,000 medical practitioners in America alone believed in and practiced electromedicine. They were forced to stop or lose their licenses to practice medicine. In the Seattle Post-Intelligencer, it's a Hearst newspaper, an article, "A Shocking Remedy," was written in 1993 by the now principal investigator at the Bastyr University, Dr. Liana Standish. And she said this: "We're at a very exciting juncture in medical history. We're starting to look at the human organism as a bioelectrical system and not just an anatomical structure. I think it's going to be some years before we know the full ramifications," unquote. Well, she has her doctorate degree in neuroscience. Modern practitioners were convinced, even in 1993, that electricity would be a vital force in curing disease. They sensed that futuristic-sounding applications such as reversal of spinal cord injuries and cures for cancer and AIDS could be achieved by a new understanding of the body's electrical system. This is not New Age thinking, because records from the 1st century A.D. describe the use of electrical eels to relieve pain and cure illness. As recently as 1997, an Austrian Oncology Society conference called Quantum Physics in Medicine, the Paradigm of the Next Millennium, which was attended by German and Austrian cancer specialists, focused on the integration of bioelectrical discoveries and conventional cancer therapies. The conference kicked off with a full introduction to the physics of electromedicine and its benefits. The conference was a giant step forward in the integration of electromedicine into conventional or even allopathic medicine. What was around the corner at the time of the Seattle Post-Intelligencer article in 1993 may be here today. One bioelectrical website claims only time will tell a long-term 90 to 120-day electromedical combination therapy has really killed off the HIV infections completely. But that is being worked on right now. If intermittent treatments are necessary to keep the infections at undetectable levels in brain cells, blood, body fluid, bone marrow, and tissues, that is going to be told in the next few months and years. But the attitude among all electromedical researchers is entirely positive. They claim they approved or not. If they are approved or not, they have a remarkably small rate of failure. So it's claimed by practitioners, if electromedical therapy is done, that even the worst HIV scenarios with viral counts over 1 million copies per milliliter and severe physical deterioration present, these synergistic therapies produce a sharp, nearly immediate drop in viral load with a corresponding rebound in immune system function. So if this can take place in that terrible disease, then think of what other diseases how they may respond. It is widely reported by practitioners that certain electromedical therapies work quickly in greatly reducing the severity and the frequency of herpes outbreaks, with some long-term chronic sufferers experiencing complete remission. A common thread among all electromedical practitioners is that the treatments are completely safe and they appear to stimulate the immune system, thereby heightening the immune response to all invaders. So all electrical treatments seem to kill off these diseases directly, allowing the immune system to revive, and this heightened immune system response kills off invading organisms. Well, it seems to be a mixture of both of these things being done, although apparently no one really knows for sure as yet if in the end it is found that electromedicine therapies are proven superior over conventional pharmaceutically based therapies for microbial infections at least. We will certainly be headed for what can be hailed as a medical revolution, one which understandably will not be well received by the pharmaceutical industry. Two of the only books in print on the subject of electromedicine are, one, The Cancer Cure That Worked, 50 Years of Suppression, by Barry Lines, and 2, Dr. Robert Becker's book, The Body Electric, which is a classic. They are both well written and researched. The first book, by Barry Lines, centers around the life of Dr. Royal Rife, or Dr. Royal Raymond Rife, and his electrical frequency cure for cancer. The therapy was tested thoroughly and successfully by the University of Southern California in the 1930s. The second, by Dr. Becker, he's a medical doctor in the U.S., about the latest discoveries and use of electricity in medicine. Some of the uses, like nerve, bone, and limb regeneration, although sounding very futuristic, have actually been accomplished. So the time has come for a new age in health. Now I want to introduce to you a machine that is the upshot of a lot of these good doctors and researchers, and it's called the BioPhoton machine. It's a machine that uses simple electricity to form a scalar wave, a new form of electricity that was invented by a fine electrician back in the 30s. And Nikolai Tesla, who was a Czechoslovakian immigrant in the United States, was an electrical wizard. And one of the forms of electricity, the scalar, a square wave, is used very efficiently in some of these small devices, and we feel that they're very efficient at bringing about some lymphatic flow, killing of some of these bugs that are bothering humans. And I want to bring to you this noble gas lymph technology that has sprung from that. This device uses noble gas. In fact, there are in these two tubes neon, or not neon, but argon, xenon, krypton, helium gases, these noble gases. And they are ignited by a monopolar way, by a scalar wave, and from that flows the photons. The photons actually do the work. And so I want to point to the research reports about this and the radio wave technologies that have also been devised. And this little plug-in the side of this instrument is a radio wave. And so I want to show you that this latest achievement by this one company is a pioneer in vibrational medicine technology. It advances the concepts of brilliant men like Nikolai Tesla and Raymond Rife, Abrams and Lakovsky, and a lot of those men. Not just one of them, but a series of these electricians have gotten together, and with full spectrum frequency technology and life-nourishing photobiotic energy machines are now being made. There's a number of them on the market. And this is now effectively being delivered by both an ionized noble gas energy field and a deeply penetrating radio wave technology. The result is an extremely wide band of light and sound harmonic frequency to establish the ideal frequency and energy state of each individual cell in the body while assisting the body's lymphatic system and circulatory system. Now, physics dictate that photons are the driving force of metabolism. Joanna Budwig in Germany, who has been up for a Nobel Prize for 5 times, I believe, has really discussed this. The driving force of metabolism is photons. Our energy in our life comes from the sun, whereas chemicals are only secondary stimulants and patterns of light information in this dynamic. And therefore, ordinary nutrition through substance falls far short in meeting our demands for full energy information directly from the sun. And so this BioPhoton machine provides a full harmonic spectrum of bioavailable photon energy to meet the body's essential need for direct, holistic, photobiotic nutrition. So we're talking about nutrition here from the sun. Now, the movement of the lymphatic system is essential in detoxifying the body. Getting nutrition in is just half of it. Getting the waste out is the other half. And the lymph system is normally pumped by the movement of our bodies. The electromagnetic field of our bodies moving through the Earth's electromagnetic field with exercise and activity. It moves this waste. However, a clogged, sluggish lymphatic system prevents the body from circulating vital fluids, eliminating this toxic waste, and it dulls the immune system response. This makes us vulnerable to infection and disease. In order to be healthy, it is essential to keep the energy and the fluids moving so the body's natural intelligence may operate in its full healing capacity. In addition, each cell has to be enlivened with its own unique frequency and ideal energy state and be fully connected to the life force energy throughout the rest of the body. So stimulating the lymphatic system by electrical fields is a well-established and recognized therapy in Europe and in Asia as an effective aid in detoxifying the body. We need to look into this. And so these are the 6 historical uses and benefits of lymphatic, full-spectrum, noble gas, frequency technology. These are the 6. 1. Oxygenating the entire body at the cellular level. 2. Detoxifying the body by moving all the fluids, the lymph and the blood. 3. Neutralizing negative thought forms and stagnant energy patterns in the body. 4. Increase energy levels and provide a sense of well-being, relaxation, and clarity. 5. For body workers and health practitioners who wish to enhance their existing therapy sessions. And 6. Full veterinary application, dramatic, rapid, reliable, life-saving results with animals. This is being done today. So now, let's see these historical uses of electromagnetic therapy. It has been successfully utilized for over 50 years to treat a wide variety of major diseases that plague the world today. Electromagnetic therapy has been reported to reduce swelling, to increase circulation, to improve overall health. Gas tube electromagnetic therapy has been widely used in Europe and Asia. The benefits that were received were substantial and they were well documented. It's a safe and easy treatment employing bioelectrical frequencies known to devitalize and destroy the structural integrity of pathogenic microorganisms, the bacteria, the fungi, the viruses, parasites, worms, sarcomas and stuff like that. So while revitalizing the normal healthy cells and stimulating the entire immune system. So the potential benefits of lymphatic and full frequency therapy is that it opens up and moves energetic fluids throughout all the channels for transport of nutrition, energy, and intelligence. It stimulates and strengthens the immune system. It oxygenates the entire body with ozone. In fact, these tubes can be placed into a bucket of water. You smell the ozone boil out of it and actually purify the water of pathogenic life forms in just a few minutes, reducing and eliminating pain from severe to chronic degeneration, and reestablishing the cells to normal frequency and energy states, detoxifying the body by moving all the fluids, the lymph and the blood, neutralizing thought forms that are negative, devitalizing pathogens, increasing the sense of well-being and relaxation, overcoming imbalances at any level of wellness for creative health. And so it's a user-friendly, simple to use, simple control device. There are some devices in Europe that stand 4 feet high with all kinds of dials and frequencies to dial in, and it's very difficult. Only technicians can use them. So we have applied the interests to people in general. How can they use it? How can we, on just a personal level, use machines like this in our own families? Well, this is why this company has gotten a simple device together that can be used with just a simple one control device here, a rheostat on there to control the power of it. Okay, now we want to mention that this device is the apex of a lot of others. There's many devices out there. Some are quite expensive, up to $6,500, and so, but we feel that getting it down to where everybody can more or less afford it, this is a big movement, and so I want to bring this to you. Now this device has a plug-in in the side of it with a radio frequency. Not a photon device, but a radio frequency. It's a little different. And this is what light therapy can actually do. Increase the circulation by increasing the formulation of new capillaries. which are additional blood vessels to replace damaged ones. That speeds up the healing process and carries more oxygen as well as nutrients needed for healing. And it can stimulate the production of collagen. Now, we're all made of collagen. Collagen is the common protein found in the body. It's the stuff that binds us together. It is the substance that holds cells together. It has a high degree of elasticity. So by increasing collagen production, less scar tissue is formed at any damaged site. And it can increase the RNA and DNA synthesis. Now, this helps damaged cells to be replaced more promptly. It can also stimulate the fibroblastic activity, which aids in the healing process. Fibroblasts are present in connective tissue and are capable of forming collagen fibers. And it can stimulate tissue granulation and connective tissue projections, which are part of this healing process of wounds and ulcers and inflamed tissue. And guess what? It will stimulate also the release of adenosine triphosphate, which is ATP, the major carrier of energy to all cells. It increases ATP and it allows cells to accept nutrients faster, get rid of waste products faster, their garbage trucks dump faster. It increases the energy level in the cell. All food turns into ATP before it is utilized in the cells. ATP provides the chemical energy that drives the chemical reaction of all cells. It also increases the lymphatic system activity. I want to talk to you a little bit about that. Edema is the swelling or the natural splinting process of the body, and it has two basic components. The first is the liquid part, which can be evacuated by the blood system, and the second is comprised of the proteins, which have to be evacuated by the lymphatic system. Now, research has shown that the lymph system, the lymph vessel diameter, and the flow of the lymph system can be doubled with the use of a light therapy. The venous diameter and the arterial diameters can be increased. This means that both parts of edema, liquid and the protein, can be evacuated at a much faster rate to relieve swelling and edema. Now, it also, because of that, relieves pain, because pain is lack of circulation. The photons of light energy enter the body as negative ions. This calls upon the body to send positive ions, like calcium, among others, to go to the area being treated. These ions assist in firing nerves, thereby relieving pain. Light therapy is successfully used in pain therapy clinics throughout the United States already. Light therapy is successfully used in dermatology and rheumatology, with excellent therapeutic effects in the treatment of shoulder humerus paraarthritis, tendonitis, carpal tunnel syndrome, and other diseases. Now, stimulating acetylcholine release and other parasympathetic effects, it also does. It also increases phagocytosis, which is the process of scavenging for and ingesting dead or degenerate cells by phagocytic cells for the purpose of cleaning up the mess inside your body. This is an important part of the infection fighting process. So destruction of the infection and the cleanup must occur before the healing process can take place. Also, it induces a thermal-like effect in the tissue. The light raises the temperature of the tissue treated, which can kill or disable temperature-sensitive bacteria and viruses. So there's a lot of good things that can come about by the use of light therapy. Now, this machine is simple to use, and I want to discuss with you just what it is. It is actually a simple device that harks back to the information that was found by Dr. Royal Rife and by others, and by our medical system, that has found out that the lymph system is very important. If it doesn't flow, then everything backs up. You have more lymphatic fluid, about 6 liters in your body, where you only have about 3 liters of blood, and you have about twice as much sometimes as the lymphatic fluid as you have blood system, the blood itself. So it must flow to carry the waste from the different organs of the body. Here's diagrams that we find in medical journals of little lymphatic glands that are surrounding all the glands inside of our body. Just in the thorax, you have about 600 of these lymphatic glands. Now, these lymphatic glands process the waste off the various cells of your body. They take the waste, they channel it. Now, the waste is channeled largely right on upstairs into the subclavian vein dump. that we call it, right here below the collarbone. Now that's a very important area here. If you look in the mirror and you can't see a collarbone sticking out there prominently, you probably have lymphatic congestion. Most women that come to my office do, and many men have lymphatic congestion. 55% of Americans have a weight problem. If you have a weight problem, then you have backed up lymphs. Almost always you have that problem. Lymphatics is the system where the body sticks and stores the stuff, the proteins that can't be used. Proteins, excessive protein eating is really rampant in the United States. We have 117 million cows, and it looks like we have a God-sent authority to eat them. But you know, they're producing too much protein in the human body. This protein, if it's excess, must be moved out. In the lymphatic system, the protein takes a charge on, and it tends to be positive charge, and these proteins wind together, they stick together, and they become sticky proteins. Mucus, we're talking about mucus. Mucus is defined in the Merck Medical Manual as undigested protein acid formation. So this undigested acids, what are we going to do with them? Well, we can unwind these proteins, change the charge of them by photons, and so that all of them will flow out and go to the exits. One of course, the big exits for our lymphatic system is right here, where we have to dump it into the subclavian vein, where it goes down, is absorbed into our bowels, taken to our kidneys, and excreted. But all of this waste from the lymphatic system has to come up from our legs and over to the left side and up to what we call a cisterna chyli, or a cistern of lymphatic fluid above or right at the belly button. And this cistern of lymphatic fluid takes all this waste out of our body, a lower part of the body. Deep breathing and bending and things like that pumps this on up and into the left subclavian vein dump, we call it up here. There's a sore place under your collarbone if you'll find it. Now, on the right side of the body, from the hip up, and all that waste comes up and is dumped into the right subclavian vein. So these are very important places. So when we turn on this machine, we turn it on by punching one button and another, and then we'll see two lights rotating because it is going on and off at a frequency. So this then is how we turn it on, and then the machine is, if I can get it unwound here, lighting up the tubes. If you look closely in a dark room, you'll see a gentle violet glow going on and off with each second count. Now, we can place these tubes right on the respective areas of our lymphatic dumps. We want to start there because the lymphatics do dump right there. We want to open it up there. If that's plugged up, how are we going to move anything out? We have to open up the dumps. So here's where we dump. And so if we just put those tubes right against it in any way of formation that you want to, then we leave them there for a few minutes to make sure that this area is open. Without that being open, then nothing will dump. If you want to go back to an area of problem, for instance, if there are lumps in the breast, and let's face it, women's breasts are just a series of lumps, they're lymphatic glands, so we want to make sure that the lymphs flow gently and freely. And so we want to go from this area here on into the axillary portion of the lymphatic system under the arms. This axillary glands under here, there's several of them, and they're large, and they process the waste from the breast and from the arm. 85% of the lymphatic flow from the breast goes into this axillary gland to be processed. And the lymphatic glands do that and then send that fluid on up here to be dumped. So if we take the tubes and go back into the axillary glands and then into the breast zone, you see, then we'll be going back to the lumps, and we can melt them out. This is the way you do it. So you have to go from this dump on to the problem. Now there are many good uses for this. In fact, my wife had a headache the other day, so we put it on her lymphatic dumps right here, went on up her neck. By the time we got to her occiput, or up here to the base of her head, her headache was gone. Headaches and all pains, of course, really come from a lack of flow, a lymphatic fluid or the blood fluid. So since the lymphatic vessels are doubled in size by the photons coming out of the tubes, then a lot of pain is relieved quite immediately. Now we find that Dr. William Campbell Douglas has a newsletter, and in that newsletter last year he had an insert in there. In fact, Dr. J. Rowan is his newsletter now, and in there he had a little insert, and the insert showing curing macular degeneration with microcurrent stimulation. So they're using a device very similar to this, using just a microcurrent and putting it right on the eyes of people. And so we have had some really good reports of people they're recharging their eyes by this device. Of course, we always encourage people to go from the dump up to their eyes. When you place it on here and turn it up, you'll feel that charge go right around your eye, back through your optic chiasm. Many people can feel this clear back in the brain. The eye works by electrical charge. Each time a photon strikes the back of the retina, an electrical charge is set up. A charge is lost in the cells. We need to recharge it. You can recharge your eyes. I wore glasses for many years, 60 years at least. Now I'm 72 and I don't need glasses. And this is one of the things I do. And so I put it right on my eyes, and it seems like after a few minutes of using this, colors come in brighter. You can see the outlines of things clearer. For older persons, this could be a real boon. And so no telling what this will do, and we can't make any claims to it. We just know from empirical evidence what it is doing. And so we get a lot of letters back from people and phone calls, and they're extremely pleased at the results. Now, we have an ability to open up lymphs. So, people under the submaxillary glands here have a lot of trouble. They have infections in their teeth. They have, and since this is a device known to kill pathogenic bacteria, we can put it on any place that's infected. And so if a person wants to go down the body, he starts at these areas up here, these subclavian vein dumps. He goes down slowly down through, because these lymphatics flow right down this way to the cisterna chyla. In fact, the lymphatics are flowing up this way. And so we can open up these tubes by going backwards through the lymphatic system. Now the cisterna chyla here, with this a lot of fluid being collected there from the lower part of the body, we should go over to the tops of the hips like this, which is where the fluid from the legs come, and leave it there for a few minutes. Go down into this inguinal ligament like this, where there's just a trail of a lot of lymphatic vessels there taking waste from the legs. And then if we want to, we can go into the lower part of the abdomen and get all those vessels in circulation in the prostates and the uteruses of women and the cystic ovaries of people, you see, and then go down the leg if we want to, and slowly go down both sides of the leg, or you can put them together, it doesn't matter, and go into the big lymphatic gland under the knee. Now we find that many people have Baker's knots, we call them, under there. They have big lymphatic vessels or glands that are just swollen. And in fact, I know a baker, friend of mine, stands there watching his baking bread, you see, and on a hard floor, and all the waste of his legs collect in that, and he has a big knot there. So he gets great relief by putting these on his leg, and down goes those large knots. You can go on down the foot, and in fact, one lady with a neuroma in the bottom of her foot that was going to have to be operated on by conventional doctors, she just placed this on her foot, one on top of her foot, left it for about 45 minutes, and the neuroma was gone. And see, she has one of these devices now. She sees its efficacy for her family and herself, and so that's why we brought it to you, to see that if you wanted to try it or use it, you can. These are available, and many healthcare practitioners now are using these throughout the United States. There is a, let's turn this off for a second, a real efficacy in this red light therapy here. Now this, when you turn this on, you will see the frequency of it is the same as the sound that you hear out of the machine. A little red light in there is an LED. Now this LED light, this light therapy, has been shown for over 40 years of independent research worldwide to deliver powerful therapeutic benefits. And both visible red light, that's 400 nanometers to 700 nanometers, and invisible infrared light, that's 700 nanometers to something like 2,000 nanometers, have been shown to affect at least 24 different positive changes at the cellular level. Visible red light at a wavelength of 660 nanometers penetrates human tissue to a depth of about 8 to 10 millimeters. It's very beneficial in treating problems close to the surface, like wounds, cuts, scars, trigger points, acupuncture points, and is particularly effective in treating infections. Infrared light penetrates to a depth of about 30 to 40 millimeters, which makes it more effective for bones, joints, deep muscles, and so forth. Although both red and infrared wavelengths penetrate to different depths and affect different tissues differently, their therapeutic effects are very similar. Now, wavelength-dependent photobiochemical reactions occur throughout nature and are involved in such things as vision, photosynthesis, tanning, vitamin D synthesis on the skin of people. And in this view, infrared therapy is really a form of light therapy. And infrared light-emitting diodes, or LEDs, and lasers are important in that they are convenient sources of intense light at wavelengths that stimulate specific pathological or physiological functions. And so Mayo Clinic has done a lot of study on this. And they put out a research report in 1989 on this. At this time, research has shown no side effects from this form of therapy other than an occasional increase in discomfort for a short period of time after treating chronic conditions. This occurs as the body reestablishes new equilibrium points following treatment. It's a phenomenon that may occur as part of the normal process of recovery. We all know in the alternative field about healing crises. Now, LEDs and lasers, you can get this in a laser, but it tends to blind people if they look into it, are no more than convenient devices producing light at specific wavelengths. In addition to the one already cited, several other studies establish that it is the light itself at specific wavelengths that is therapeutic in nature, not the machine that produced it. Now, all biological systems have a unique absorption spectrum, which determines what wavelengths of radiation will be absorbed to give a proven therapeutic effect. The visible red and invisible infrared portions of the spectrum have been shown to be highly absorbent, and unique therapeutic effects come from it in living tissues. There is a difference between infrared LEDs and lasers. LEDs are easier to use and less dangerous, however. So the light therapy can really do a lot of stuff. And we went through quite a bit of that in relieving pain, increasing lymphatic circulation, stimulating the release of ATP, and forming projections in the collagen where it grows faster. So there's a lot of things that can be done with this machine. I particularly am interested in the eyes, and several good doctors and ophthalmologists throughout the United States, including a doctor in Phoenix, Dr. Kondrat, that is using it with great efficacy and becoming quite famous by using this in the treatment of macular degeneration. Now, macular degeneration is the #1 cause of blindness now in the United States. And so we want to turn that around. We haven't anything, it seems like, to fight this with. We might mention, too, that in macular degeneration, we have the wet form and the dry form. Both of these forms respond to electrical stimulation. I didn't mention the grounding plate, and this makes the machine more powerful. This is simply a grounding plate that goes into the machine that you can put against your skin. Say right here would be a good place below the belly button. And when you use the photon tubes or this device that's different, the radio frequency device, either one of them, you could have a ground and make it more effective. Because once the photons enter you, then the grounding plate takes it back into the machine, and your body becomes or acts as a capacitor. As this electrical information flows through you and through the machine, it becomes quite effective and more powerful. So the use of the grounding plate is not necessary, but it is very useful to make it more a stronger pulsation. So with this device, we can't make claims about it, but we can use it and tell each other how it affects us. This is legal, and we just can't make any medical claims about it. However, we know that the medical community has studied similar devices and has used them. However, it's not in their protocols, so it's doubtful whether it will be for a long, long time. We want to bring this to you as good information because a lot of people in this alternative health care field are using it. We have estheticians using this just for toning the skin. We're using it to help get rid of wrinkles and that sort of thing. We have people sleeping with this in their pillow, and it seems to really activate the circulation in the gray matter. It can penetrate that deeply, and that aids in the Alzheimer's conquest, you see. So we have some really good stories coming in, and we have a couple little booklets that sometimes when people get this machine, we give them these booklets with letters from people, and it is very interesting what their experience has been with this. Sometimes they report quite a change in bowel habits, in urination, and things that come out of them, and so we know that it's really affecting their elimination process. The lymphatic system is so important. Books are written on this. In fact, I have one of the books here that takes up its effect on tissue and establishes a protocol on how to use the photon tubes and where to place them and approximately how long. If a person is in a chronic disease, of course, he would use it in a shorter time than a well person. And so there's chronic and degenerative and acute diseases. So the use of that, though, is not that important to know these things because it's more or less like in the alternative field. We have a lot of herbs that they're nutritive. And those nutritive herbs can be used just anytime you want to and about as much as you want to. And so it's the way it is. If you use it more often, then you will tell its effects more acutely. If you use it less often, then usually not so much. But still, I've had several years' experience now using this machine, and I think it's the best one on the market, and it retails for about $2,400. So around there you can get these machines, and the prices seem to be going down all the time. You know, the original ones were quite expensive. Some of them on the market are very expensive, and I don't think they're really necessary to go into that expense, but a lot of healthcare providers have these, and possibly you can use them at their offices, their establishments. There are a number of doctors throughout the United States using this in their specific applications. Sometimes for infections, sometimes for the eyes, like Dr. Kondrat is using these nice machines, and there are a number of them on the market. I would advise you to investigate them, to read about them, to look into that. If you can't get a hold of diseases like fibromyalgia, this general pain in the body, look into this, because the Centers for Pain and Wellness throughout the United States are using these devices, and these devices are available for people to buy and to use themselves in their own homes. So I think that this bringing this to you, this Rife Tesla technology now that has been combined in this machine, is excellent. Dr. Tesla knew that the scalar wave could be used for warfare or for healing. He commented about that in his lifetime back in the 30s, and it was never used. Well, today is the time to be using these things. This is the day when we are stepping out and a new paradigm is forming. So we need to look into these efficacy producing machines and the herbal field and start using them and seeing what we can do for ourselves to keep ourselves healthy. So I'm glad to bring these things to you, and we'll see you again. The BioPhoton machine is new, and people have questions about it. Most of these questions are very simply answered because it's not a complicated device to use. And so here's some of the questions people have about the machine. Is it too complicated for me to use? Well, that's the number one shot. No, not really. We have children using it. In fact, they use it on dogs and cats. It stops the weeping of little Maltese from their eyes. It's very interesting to see that clear up on dogs. In fact, children use it. Everybody uses it very easily. All they have to do is turn it on and put it on them and adjust the power of the device. So it's not a difficult thing, and it comes with a little booklet explaining how to use it. Now the second question that comes, what if it breaks down? What if I break a tube? It's a very strong tube, you know, but you can break them. But yeah, there's a guarantee on the machine for a year, and you can buy a new tube for about $100 to $120. There are different size tubes. There are tubes that are pronged for carpal tunnel syndrome. There are tubes that are triangular that massage therapists use for deep muscle therapy and stuff. And so there's different kinds of tubes. There's L-shaped tubes. There are triangular ones, so you can buy these different tubes for about $100 to $125. And the company will stand behind its work on that. Now, the question comes up, what about heart pacers or pregnant women? Well, we think that we don't supply them to any of these electrical devices or in people. We advise them not to use it. And of course, no studies have been done with pregnancy and all that, so we advise them not to use it either. And as far as age is concerned, little babies and those, it relaxes a person. Babies that are whimpering, that have colic, that have infections, be very good to use on babies. There's no problem there. Now, the question comes up, can I overuse it? Well, not really. Because in about 45 minutes, it seems that the body sets up an electrical resistance to the force of the tubes, or anything coming into the body. So we find that 40 to 45 minutes is about the limit for use on it. But I've seen them use it for hours at a time, and nothing really untoward happens. It just is not as efficient. Now, the question comes up, can I put it anywhere? Well, yes, you can. In fact, after you go through, you put it there at the subclavian vein dump, right here below the collarbone, which I explained is very necessary to do to open up that dump, then you can go to anywhere in the body. And specific areas that you have problems, you can just put it there if you want to, and see its efficacy, particularly at the occiput back here, in the lower back zone, and in the abdomen region. These are very good places to put it. The chakra points a lot of people know about, and massage therapists use, very good places to use it. Now, how many people can use it at once? Well, we find that about 100 people at once. We have had as many as 400. I believe that it could do 1,000 people at once. We have big groups now. We had the University of Arizona people lately. We had a big group over in Los Angeles lately. And we got a huge group together in a room. And we find that if 400 people get together and hold hands, and one person grabs one of the photon tubes, and another person takes the other, and they all join hands around a room, the efficacy of this will be felt clear 400 people away, just as brightly as people holding the tubes. So you'll find that some people, though, cannot take it full power, so we turn it down. Turn it up to where everybody can feel just a slight impingement of those photons on it. You just feel a slight 1 amp current. But this current is a scalar current, and it goes all the way around a large room of people. There are whole groups of people now buying these machines, getting together to get them, and then coming together and using it as groups. So this is another way or facet of the use of the BioPhoton machine. These are the general questions that we find come in about the machine, and if there are any others, I'm free to answer them, or the company will answer them. I feel that this is the new wave of the electromedicine field of the alternative medicine. And so we need to become familiar with that and see that it is available for everyone to use. And I thank you for your time.